All right, next up we have a PQI clinical overview with Regorafenib in hepatocellular carcinoma, or HCC. This PQI is actually now available on the NCODA website at encoda.org. And with us to do the overview is Jody Agina from Virginia Cancer Specialists. Jody?
Hi, thanks for having me. My name's Jody. From Virginia Cancer Specialists in Fairfax, Virginia. We're a U.S. oncology practice, and I'd like to talk to you guys a little bit about regorafenib in the setting of hepatocellular carcinoma. Really quickly, the main thrust of this PQI was to effectively understand how to manage the adverse effects of regorafenib. I mean, it's a pretty tough treatment, and this is specifically in the setting of hepatocellular carcinoma. Little background: this drug is a kinase inhibitor indicated for the treatment of patients with Child-Pugh A hepatocellular carcinoma who have been previously treated with sorafenib. And this pertains to a phase 3 resource trial where regorafenib was assessed in patients with HCC who have progressed on sorafenib, and they came to the conclusion that there was an improved overall survival, 10.6 months compared to 7.8 months. And this study also portrayed that the difficulties of maintaining therapy, as the discontinuation rate was 68%. Next. And in the same study, the median time to progression was 3.2 months compared to 1.5 months. The rates of grade 3 AEs grade 3 and 4 AEs were almost 80% with regorafenib compared to 58.5% with the placebo. Right now, I believe it just concluded because, but when I was writing this up, this study was ongoing, this REDOS trial, which was a regorafenib titration study in the setting of metastatic colorectal cancer. And why I included this was it looked at the efficacy of pretty much starting regorafenib at a 50% of the dose and titrating upwards. And what they found was that this treatment strategy was superior to the original indication or original dosing indication of 160 milligrams once per day. I mean, patients were able to tolerate it a lot better. There were less dose modifications / discontinuations. Next. And in addition to regorafenib, there are other second-line options, including nivolumab, which has great data on it. Patients that are not eligible for nivolumab may include those with other comorbidities, but not limited to pneumonitis, thyroid disorders, renal dysfunction, and colitis. Just for your dosing background, the indication, or the FDA indication, is states 160 milligrams once daily, which is 4 40 milligram tablets for 21 days out of 28 days. And I say consider the dose titration because the data just recently came out this year that the 80 milligram starting dose where you titrate up has been shown superior. You're supposed to take it at the same time each day, swallow tablets whole with water after a low-fat meal. And for the pharmacist or for the pharmacy technicians, upon receipt of a new prescription for regorafenib, in this typical starting dose of 160 QD, consider initiating the titrated dose, and this is something that we've incorporated into our practice as well, just recently. Try to coordinate or establish a weekly follow-up call with the patients. You want to monitor their LFTs, CBC, platelets. Make sure you look at your blood pressure, because it does have hypertension associated with this. Hand, foot, skin reactions are very common with this. So you want to monitor that weekly for at least the first 2 cycles, and then every cycle thereafter. Monitor signs and symptoms of cardiac issues, bleeding, GI perforation or fistula, infection, and neurological symptoms as well as impaired wound healing. You want to consider using a urea-based moisturizer. And I know in the REDOS trial, they used a preemptive dose of steroid ointment, clobetasol, the 0.05% ointment. And that's something that we haven't implemented for all of our patients, but we've communicated this to the physicians, and every time there's a new regorafenib script, from the pharmacy standpoint, we try to communicate that to the physicians to add this into the regimen. And you want to counsel patients regarding safety risks on proper amount of dose per cycle based on the regimen changes. Understanding your organization's dispensing protocol, and that Stivarga currently comes in a package of a size of 28 tablets, which may or may not be a suitable amount. As far as patient-centered activities, we do provide the oral chemotherapy education form. You really want to counsel patients. You want to make sure that they understand the dosing, that it's once daily for 3 weeks, followed by a 1-week break, and that the medication expires 7 weeks after the opening of the bottle. So they can't leave it on the shelf and, think that they're going to be using it for months to follow. Make sure that the patients take the dosage appropriately with a low-fat meal, and examples of low-fat options: dairy products, fish, meat, poultry, etc. But you definitely want to reiterate that the patients understand how to take it, and know that there is a 1-week break, which I'm sure sometimes can be confusing to patients. And I think that's it. Is there any questions?
Thank you, Jody. Just to let everyone know, if you have any questions, feel free to click the raise hand function or type it in the chat or Q&A box, and we'll be able to relay those over to Jody. We actually have one question that's come in so far. Jody, the question is, can you go more into detail about how your practice implements the dose titration protocol of the regorafenib, and are you aware of any other practices that use this dose titration?
So when this study was actually ongoing, or when this study concluded, US Oncology was pretty reactive in adding this to the EMR, and once it was added into the EMR as a regorafenib titration protocol or a regimen, pharmacy reiterated to the physicians that this was an option, and most of our physicians are utilizing this option instead of the traditional regimen that's in there. Patients seem to be tolerating this a lot better, with better management of the side effects.
Awesome. Thank you, Jody.